All right, I'm Dr. Craig Pratarelli. Today we're going to discuss the natural alternatives to medication. And the reason for this is that a lot of the medications become toxic in certain amounts. And I've made some PowerPoints that you can see here. So as the advent of organic chemistry progressed, so did the ability to synthesize and extract particular substances. So prior to this, the amount of substance that somebody would be taking in therapeutic doses never became individually toxic. However, as we developed the amount to synthesize and extract, more the extraction process, various amounts of particular substances from a plant, the amount that we were given to the patients was available in amounts that were toxic, and that would tend to make them have side effects and other symptoms as well. So what we found, there were three major issues using high doses of single substance ingredients or treatments. And when you move from the plant itself, there are more than just one substances in a plant that will contribute to the treatment of the disorder. So by giving you an extraction from that plant, you're taking away part of the healing process of the other portions of the plant that are left behind. Many of these substances are found in tolerable amounts in the body in their natural form, but then, as I mentioned before, found in toxic amounts in the concentration when they're given to the patient. Again, the administration of these pharmaceuticals are more likely to cause unwanted side effects when they are usually found in their natural form. They're not going to cause those side effects. Again, here, today we find that there are several naturopathic schools around the world, several doctoral level programs fully accredited in the United States. And these focus on exclusively the use of natural plants and plant products to treat disorders. And previously, many cultures, for example, a good one would be India, used various plants to treat diseases as there was little or no alternative. And one of these that was used on this continent was the willow bark. And the willow bark had strong anti-inflammatory properties. So it was used here by the people who were living here well before the arrival of Columbus. And it was known to relieve fever and pain. And when we started developing chemical techniques to look at the thing, we could see how that the contents of the willow bark, when analyzed chemically, were the same as found in aspirin today. So you could take the willow bark. The next one is probably my favorite one. This has come under some controversy lately. If you go to the Chinese restaurant and you have the sweet and sour sauce, you'll find that it has a red color. Well, what makes that red is something called red yeast rice. It's used as a dye. It has the same substance in it as the drug lovastatin, which is a HMG-CoA reductase inhibitor, meaning all that it does is block one of the steps in the pathway of taking the precursor chemicals to making it cholesterol. And so with the statin drugs, you're going to run into a lot of side effects, problems with the cell development, hormonal influence problems as well. Whereas when you would take the red yeast rice in the non-toxic amounts, you would bring down the cholesterol amount. But cholesterol, again, has such an efficient pathway, it's very hard to reduce. Again, my favorite one is garlic. And garlic has a number of uses in medicine and health. The one I rather focus on today is the high tolerance of it compared to the other anti-hypertensive drugs. So when you're taking ACE inhibitors, they have like edema as a result, dry cough, such as Captopril, Yeah. And it works very much the same way as the ACE inhibitors work, the angiotensinogen enzyme inhibitors. So garlic, again, very high tolerance for the body. Although you have to use it sparingly in your recipes, it just becomes a little difficult to eat after a while. And like I talked about, captopril will produce dizziness, lightheadedness, metallic taste in the body, cough, excessive tiredness, and a fast heartbeat, of course. And that dry cough, we're going to have to move to another drug working on the same thing. Whereas the garlic itself isn't going to cause the dry cough. And here, honey, again, natural. This is, again, another thing that has a lot of properties useful to it. For example, allergies. Now, you have to use local honey in order for that to work on the allergies, meaning that you have to have the honey come from a hive that is located within 5 miles of your house. That being the case, you can use the same chemical principle that is used in the treatment of allergies when you're using systematic desensitization via the honey. Again, also we found some chemicals in there that are too toxic when resolved from the honey itself into a pure form, but are found in good amounts that are therapeutic to reduce fatty liver. Again, feverfew tea. This one is quite interesting. It reduces and prevents migraine headaches. So it's going to reduce the duration of it. So instead of having an hour-long migraine, it's going to take it long. And the number is going to go on. It can also be used for fevers, rheumatoid arthritis, and some people give it for insect bites. And it's frequently taken tea. You can find it in pretty much any regular store. Now, as I go about my functions, I find that there's a lot of people taking alprazolam and diazepam, the brand name on that being Xanax and Valium. And there is a very nice natural substance to that, which is non-addictive, called chamomile tea. Has in Spanish they call it manzanilla, has a taste of apples, and there are no more allergies with this than other drug uses. So you're going to run into a little concern with allergies on this, but not more than you would people having reactions to the other drugs that we've talked about here. So what's going to happen? Chamomile, great for insomnia, anxiety, gastrointestinal disorders, ulcers, insomnia, inflammation as well. Again, turmeric used in Ayurvedic medicine. Ayurvedic medicine is a natural form of medicine in India as well. It's used heavily in Indian cooking. It helps with allergies, respiratory infections, again, arthritis and liver disease as well. But the most interesting thing that we find with turmeric is that we've found that there's a correlation, a negative correlation actually, with the amount of turmeric and Alzheimer's disease. In the country of India, we find very little Alzheimer's disease, whereas in the United States, we find a greater amount. When you compare this with the amount of turmeric intake, again, this may be having to do with the anti-inflammatory effects, you're finding less amounts or a greater resilience to the cause of Alzheimer's disease, whatever it might be. Again, cumin, again, known in a lot of places, comino, helps, again, with the immune system. More specifically, if we were given the amounts that are found in warfarin, again, you're going to have toxic reactions, possible bleeding, hemorrhage, something like that, because it suppresses clotting factors 2, 7, 9, and 10. That being the case, if you're taking cumin naturally, you're not going to take it in an amount where you're going to get that toxic reaction and where you're going to have the hemorrhage. And cloves, this is, again, one of our experiments in organic chemistry in undergraduate college was to remove the lidocaine from the cloves. And I do recall my grandmother using the cloves on the farm to treat the pain, dental pain. Again, so the problem with lidocaine is that it is cardiotoxic. So if you don't need to use lidocaine, you can, as such, and you can get it in various forms. You can use the cloves itself, and with this, the lidocaine has to be used with epinephrine to stop bleeding during during oral surgery. We used to use another substance, natural in this case, to prevent that from occurring. In such case, now with the cloves, you're not going to reach that toxic amount where you're going to have cardiac reaction. Thank you.